not share my stuff. Razia started opening her mind to not only creating online environments for a class, but she started putting things up on the OER site. We haven't moved since then, I must say. There were a few of them, and then people just don't want to share. That's a debate on its own. So welcome. Maybe you can tell us some of the frustrations around sharing.
Thank you. Good morning, everybody. Thank you for inviting me to share some of my experiences. Today I'll be talking just a little bit about my blended learning and teaching approach in dentistry. Up front, I'd like to say that the work that I'm presenting here today is due to a collaborative effort with a number of people and centers. So I'd like to thank the Center for Innovative Educational and Communication Technology, Digital Media, specifically Marion Homans, Carolyn Keese, Narina Graf, Andre Daniels, and Bradley Knight. OER Africa, Professor Stephen Bain, the University of Michigan, Professor Wendy McMillan, who is the Teaching and Learning Specialist at the Faculty of Dentistry, dental students past and present, some of them who have allowed me to use their feedback in this presentation, and the Kellogg Foundation. Now, I see there are quite a number of my colleagues, so I'm not sure that I need to explain this slide, but for those of you who don't know, when I started out with blended learning and teaching, I was a lecturer in the prosthetics department, which is responsible for teaching dental students how to make a prosthesis, so a set of dentures basically. And in the fourth year of study, the students are expected to fabricate a complete set of dentures for patients.
Talk closer into the mic, please.
Oh, okay, sorry. And the lecturers in the prosthetic department then teach them the previous year the preclinical techniques and also the laboratory techniques in how to manufacture this. So the lecturers in the prosthetic department also have to teach them the theory of the discipline, but they're also responsible for supervising them in the clinical area when they're actually treating patients. It's during my time in the clinics and in this specific department that I found that often students had difficulty in translating the theory to the practical, and they also couldn't actually execute the procedure because often they would have only seen the procedure being done once before. This is often how sometimes we need to demonstrate a procedure, and so if you have a class of 78 up to 90, it's often very difficult for them to see, and the mouth is a very confined space. In an effort to ensure that all the clinical teachers are then teaching the same principles to the students and also to make it easier for the students to revise content, the department does provide the student with a very well put together module guide and also gives them a recommended clinical guideline document, which then clearly outlines step-by-step instructions of how to execute some of these procedures. In the clinical area, the clinical teachers then have to balance chairside teaching together with treating a patient, which can be very demanding. And in this discipline, if a procedure is not completed in the allotted time, the delay could mean that the subsequent treatment stages are also delayed and the patient actually receives the denture much later. In extreme cases, it may mean that the student, if they have not progressed, does not meet the practical requirements of the module and doesn't advance to the following year. So I started thinking in terms of what would be useful for the student, and I thought it would be really nice if the student sort of had a library of videos which would allow them not only just to revise the content and put together the theory with the practical exercises, but also as a refresher prior to entering the clinical area when they'd actually be treating a patient. So the use of the digital videos in clinical scenario would allow the students to direct their own pace of learning, input their own views, they could interact with other students, and they'd also revisit learning points more easily and create their own future learning textbook, electronic textbook. In 2010, the University of Michigan, together with the Kellogg Foundation, invited participants to submit a protocol for developing teaching material. I submitted a protocol in terms of teaching a specific procedure within the discipline of prosthetics. So this was an OER, or Open Education Resource Project, which meant that I created 3 videos for students with regards to a specific procedure. I was a dentist, but I very quickly became a producer, a director, a lighting expert, an editor, and a scriptwriter. And it was quite a steep learning curve, but together with the help from the team, I managed to complete the videos. These videos are on YouTube and they're also on the OER Africa site. Now I just want to share with you some of the feedback from the students who have used the videos. As you can see, the students are already using content which is available online, not only this content, but other content that they find on YouTube. And often they may not be appropriate in terms of learning and what we are teaching. So it was very nice for me that they could actually use this video, which then correlates very well with what we are teaching in class. And that's just another feedback from a student. During this time, I also moved departments, and then I became responsible for teaching dental materials in terms of the restorative dentistry, which is where you put fillings in and not make the dentures. And with regards to that teaching, it is again something material which is very theoretical, but the application is very practical. And often we have to go through volumes of materials as students, which then all have to come together when they're in the clinical context. And I started putting together a CD, which would then have content of the specific products that they use in the clinical area, together with procedural videos, which some of them are not just content I've created, but I've also used from other institutions. So that has been very useful for students. Also initially in the beginning before eCamva, when students had trouble accessing the videos and there was bandwidth problems, it was very helpful for them to actually have a CD instead of having to wait for something to download. Then last year, I was faced with a dilemma with marking. I had about 5 courses to mark, and 3 of them were writing on the same day, and I thought surely there must be a better way for this. And I started with some training with eCamva and online assessment, and I think what I realized is that the way that I then set up my exam paper or any type of assessment is also very different in terms of an online assessment. Often it's a very short questions is what we often use, and maybe essay questions, but I needed something that would actually mark itself. So then it would mean that I had multiple choice questions, match column A and B, which again you need to have the resources or you need to have a bank. Because of my connections with the University of Michigan, I then collaborated with Professor Stephen Bain, who is then the head of the dental materials division there, and he has then shared his bank of multiple choice questions, which I now use. And I've only just started with online assessment in my module, so I think there's quite a number of exciting possibilities there, not just for me as the lecturer, but also as a learning tool for the students to give them feedback. So I'd just like to end off my presentation with some feedback from a student. And to me, this is really important in terms of a lecture. It's not so much as making my life easier, but it's about improving the learning experience of the dental students. Thank you.
Thank you very much, Razia. And as you can see, she pointed out that she too went on a journey. She attained many skills, e-skills and other related skills. And thank you for giving your students access. But more importantly, I think Razia has shown, which we always say, yes, there's material available on YouTube. We can use it.